All right, welcome back to another episode of the Digital Health Podcast. If this is your first episode, man, we have a great episode for you today. My name is Anthony Virgo. For folks who don't know me, I spent the last 7 years at a health tech startup and then transitioned in building my own AI automation company with my partner and co-host Kazar. Kazar, go ahead and introduce yourself.
Hello everyone, my name is Faizaz Shahid and I have been working in the healthcare domain for quite a while. I started with the dental practices, but then we expanded into the other sectors as well, like the physiotherapist, psychologist, cardiologist, and now we are working with a lot of healthcare professionals. This is the brief introduction about us. Now I want to kick it over to our guest, Robert.
Kishar, Anthony, everybody, thank you for having me. I'm coming to you from Dublin in Ireland, a couple of hours later than you are now. I'm a cardiologist. I am a lifestyle medicine expert. I actually have an AI champion role in our hospital. And I trained part of my career in the University of North Carolina back almost 20 years ago. So I look forward to this conversation with the great guys here, Anthony and Kazar.
So from the start of the conversation, we know that we have the AI guy today on our podcast.
Right. This is a rare time where for the first time of us actually recording, we actually someone who's like a champion of AI. So so this might be a different conversation than what we're used to. But before we even dive deep into technology and get into the digital part, so Professor Robert, how did you get started, right? How did you get started in the healthcare industry? How did you kind of come to this journey and then make it your path in life? The reason why I ask is because a lot of people have different stories on to how they got into healthcare. There's a bunch of people who knew that, they when they were little, they wanted to grow up and become a doctor, and the healthcare system was like a straight and narrow path for them. But someone like myself and a few others, we kind of fell into the healthcare industry by accident. I tell people all the time, I was a sales guy before. I was selling cars. So like sales commission was like my day to day. I like lived and breathed it. And then when I got into healthcare, it was kind of like a little bit opposite. Still kind of cutthroat a little bit, but still, still different in ways. But I didn't see myself actually coming into the healthcare industry, but now is an industry that I've grown to love and appreciate, even in my day to day and how I live my life. I usually tell people if I wasn't in the healthcare industry, I wouldn't even be the best version of myself, because being in this industry has allowed me to take my health serious, my mental health serious, my physical health serious in many ways. So just wanted to ask it and kick it to you. How did you actually start your journey and get started in the healthcare industry?
So I grew up in a family where my mother and father are both surgeons. My father was a kidney surgeon. My mother was an eye surgeon. So there was a potential as I came through school that I might just end up doing medicine. And that's exactly what happened. I went on through medical school in Dublin. Along that journey, it became clear to me that I did not want to be a surgeon. No disrespect to my parents, but there were just aspects of it that just didn't lend themselves to me. And so I ended up becoming a cardiologist through my training. I trained in Ireland, I trained in the UK, I trained in the US, as I've mentioned. And then I'm now based in Ireland, where I work in private practice as a cardiologist. My journey in cardiology is interesting. I trained in interventional cardiology, that's putting stents in people and treating heart attacks. Ironically, it turned around and I decided I wanted to do more prevention, because a lot of the patients coming through ended up having the same problems despite all the technology we were putting in them. So my career has evolved a lot that, and I've been working as an attending or a consultant cardiologist here for just short of 20 years.
Okay, so a little almost straight and narrow, but a few curves in there as
Yes.
well. So I guess what was it about cardiology that actually like spoke out to you? As you said, like your parents were surgeons, and there's so many different paths you can take. Whether it's like family medicine and a bunch of other specialties that you can specifically do. What was it about this specialty that actually spoke out to you, that made you want to pursue it further?
So I always wanted to do something in medicine that was very acutely based. So that means like you come in, you'd have a heart attack, I'd open up an artery, you'd stick a stent in, everything, all problems solved, you get to survive, you go home in a few days. The reality is, when you go into private practice, which I work in, you have to spend loads of days seeing patients to get to do procedures on patients. So it doesn't quite work out the way that it was planned to work out.
Okay, okay, I see. I understand the dynamics there. So explain to me. I mean, you mentioned that you spent a little bit of time in North Carolina, and now you're in Ireland. I'm pretty sure the health systems are a little bit different, but the same in some aspects, right? What are some, I guess, what are some differences in the healthcare system over there that you might have observed in North Carolina and vice versa? I guess what are some things that you might have seen at North Carolina that they were doing good during that time? Um, and then there's some things that obviously you're probably doing now that might benefit the US. So what are some things that are going on within your space that you could maybe tap in about?
So, in terms of what I do, in Ireland, the system has two halves. There's a system that's privately funded where patients take out health insurance and you pay to use the different facilities in Ireland. So, they're dedicated private hospitals. But there's also a system that half the population get access to if you don't have private health insurance, where if you are below a certain income threshold or a level of affordability of private health insurance, you can go to the public hospital. When I worked in North Carolina, one of the most shocking things I discovered was that I worked in North Carolina in the early in the early 2000s. When I was in North Carolina, I could not believe, because I thought America was the best country that existed on the planet. I thought the health system would match that greatness that I held about America. And then I discovered very quickly that a lot of people don't get access to any health care, that it's hugely education, it's hugely to do with what part of the community you come from. And I didn't realize how big North Carolina is. Its land size is about 4 times the size of the whole of the United Kingdom, if not more. I was involved in a heart attack project that called the RACE Initiative, which set up the system in North Carolina to deliver patients to where they had to be treated for heart attacks. Some parts of North Carolina, I remember in the study, you'd go into the local shop if you were having a heart attack. You'd look for Dr. X if he happened to be around. Somebody would ask somebody else for an aspirin tablet, and then you'd be lucky if there was anybody there who could treat you. There were other places where there'd be a small clinic and there'd be a nurse. There were parts of the US where you could take a helicopter and fly you into the best centre. That was 20 years ago. 20 years later, that's quite extraordinary. Now, in Ireland, we're gradually getting to helicopters. Ireland's tiny by comparison to North Carolina as a country. It's very, very small in size. We have a population of about 5 million people. All our heart attack care gets taken care of in the public health system because the infrastructure is built that way. It's built that if you have a heart attack, you call a telephone number, you get delivered to the heart attack centre. We have a couple of heart attack centres throughout the country, and that system works. And that's the system I got involved in 20 years ago in terms of how the infrastructure that came to be. So, there's a lot even in 20 years that has evolved and made the whole process much better. So that's kind of the shared insights between this part of the world and that part of the world.
Wow, that's interesting. That's something I had no idea about. And you're right. I think a lot of people do think like our healthcare system is like really, really good, but you once you're like in it and in the nitty gritty and then working with people in the community, you understand that a lot of people aren't getting the benefits that they need. Right? There might be, even in my work on a day to day when I was in the healthcare tech company, a lot of our members might have lived in underdeserved population who didn't have a lot of food or just didn't have a lot of resources. So they being that they didn't have fresh foods, they're eating fast food all the time. So hypertension, diabetes being like a really, really prominent thing in those communities was it happens on a day to day depending on where you're at in America. 100%. What would you say is a misconception about heart health, or you being you practicing specifically with working with people hearts, or when someone have a heart attack? What is something that maybe the average person might not know about the heart that you could maybe share with us in terms of heart health, or just something that the average person might not even be aware of from your experience?
So one of the most alarming things that most people mightn't be aware of is you can get a heart attack in your 20s. You don't have to be 50 years of age. You don't have to be 60 years of age. The plaque that builds up in the artery to cause a heart attack starts in your 20s. So a lot of people would think heart disease and heart attacks are for people who are much older than that. The same is true with other heart conditions. Most people don't know they have high blood pressure. Most people have no idea what their cholesterol is like or their blood sugar is like. As we said, in some parts of your world, access to a basic medical clinic to know that it can be challenging. I used to remember when I worked in North Carolina, you see lots of people who had no health care. And when they presented with, no blood flow in one of their legs. They were only in their 20s, which was just kind of the worst thing you could possibly imagine as a way that was what a care looked like in a modern world. So I think it's really important for people to understand about heart disease, that it can happen at any age, that you should be aware about it. And in the ideal setting, you should go and just have even basic medical checks, even like your blood pressure. I mean, your blood pressure, you won't know about it unless you check it. It's one of the biggest problems in the world. It's other major issues that even if you do know it, you've got to do something with it or something about it. You've got to follow through, have the treatment follow up to see the blood pressure is controlled. And the blood pressure is a big, big issue, particularly as you get older. It's also a very big issue in the African American population in the US because it's very, very prevalent, and it's also more challenging to treat it for some reason. So I think it's important that you understand this. Just because you might look good on the outside, you don't really know what's going on the inside. So I think that's vital that you understand that.
Right, 100%. That's good information to know. I guess my follow up to that would be what because you're right. I have heard of so many people who might be 20s, 30s, or might have a heart attack out of nowhere, and I'm like, whoa, what is going on? Why do I feel like I'm finding out that people are getting heart attacks younger and younger for some reason. I always equated it to like maybe an age thing, but now that you're speaking, it might be a bunch of other things. I guess what are some of those factors? Like, so say for example, if I were to go into my primary care doctor and then and do a physical, and then they tell me, hey, my blood pressure is high, what's kind of like my next step? How can I guess take control of my own health if I'm not too educated about heart health or what's going on
Sure.
with my heart, I guess?
So, I mean, I think there's a couple of things at a very basic level. So, I'm a cardiologist, but I'm also an expert in an area of medicine called lifestyle medicine. And lifestyle medicine is effectively the way you live your life. So, it's at a simple level, it's about the food you eat, it's about the exercise you do or you don't take, it's about whether you struggle with your sleep, whether you struggle with stress, whether you have a life that involves very few other people or few social contacts, and whether you smoke or whether you drink too much alcohol or whether you're taking drugs. So at a very simple, straightforward level, the food you eat. So if you take high blood pressure again, if you're putting a lot of salt on your plate, you're going to get high blood pressure. If you're adding a lot of salt to your food, there's a risk you'll get high blood pressure. If you eat a lot of processed food, or a lot of fried food, or if you eat a lot of food with sugar, you're going to get more likely to get things like cholesterol, blood pressure, diabetes. So a lot of the heart conditions come from the food you eat. It's a big factor to it. If you smoke cigarettes, if you drink too much alcohol, if you're doing drugs, people know these things cause diseases. And then the other factors, what people may not know, is if you have very poor quality sleep, and you find that when you're waking up every day, you're feeling tired all the time, that usually reflects there's something either going on during your night. So you might be snoring a lot, or you might be very restless in the bed, or you might have a very busy, stressful life every day, that you eat late, that you don't get good quality sleep, you're looking at your phone late, you're watching the television late. All those things are actually really bad for your health. That bad sleep, all that stress that you might have from work as well, they all increase the risk of having a heart attack by about 30%. So they're not insignificant things. They're very, very real things. So if you want a very practical, simple level where you may not have access to healthcare, well, then look at your diet. Get out and move around, take a bit of exercise. Pay some attention to your sleeping pattern and whether there's something going on. Pay attention to where you're getting sources of stress. Stop smoking. Cut back on the alcohol. Do not be doing illicit drugs, which unfortunately are often the cause of your heart attacks in young patients.
Dr. Robert, I want to shift our conversation towards the AI aspect in cardiology. After all, we
Sure.
have the AI champion today in our podcast. So, how do you see and the AI integrating into the healthcare sector, specifically in the Ireland.
So I said I was a champion in AI for cardiology. This is a very recent title I've acquired, and I mean recent being a couple of weeks. So one of the big challenges has been who's kind of making decisions. Because if you work in a hospital, you have an IT department who think they know AI. You have a bunch of senior management, they think they know AI. You have a bunch of doctors, you have a bunch of patients, you have lots of different stakeholders. And the truth is, nobody is speaking the same language. So in the cardiology department, what we decided to do was to try and identify somebody I was asked to do it by the senior management, if I would engage with opportunities around AI that might help us learn a little bit in our cardiology department. So we've approached this by looking at a few areas of kind of challenges or unmet needs. So one example is we find that the processing of tests that patients have done takes a very long time. Sometimes it takes a very long time because the actual interpretation of the test requires a lot of human analysis. So we try to see if there's technology out there that can do something to make that time frame shorter. So we are engaged with a company trying to do that. One of the other things which I do understand exists in the US already is the idea of using scribes for writing letters when you're in your clinic or writing medical records. And so there's a number of different scribe providers here in this country, which, believe it or not, are not already established in many hospitals. So that is a space that we're working through to tailor something that reflects the way our system works. And we have a number of other things. I mean, in the US, you have an electronic health record. In Ireland, believe it or not, we do not have an electronic health record. So for one of the other challenges is where you have a lot already. AI is not going to solve create all the solutions that you have in the US and stick them in Ireland. It doesn't work that way, as you know. We are going to still have to solve an awful lot of other baseline issues to really get the best out of AI, rather than sticking a bad solution into an AI set of tools and coming out with something that we think is brilliant because it's with AI, but actually it doesn't do any better of a job as to what we had in the first place.
Got it, got it. I had no idea you guys didn't have like EHR
No.
systems out there. Wow, that's interesting. How are you guys operating? How does that work? I
Oh,
think I'm so used to having like this EHR system, whether not even just for AI, because usually when we work with our clients here, we're able to just sync everything with the EHR and everything. But it sounds like if you want to incorporate something like AI, you will have to start from the ground zero to
yeah.
even
That,
do that.
but that's totally true what you're saying. So we have our primary care doctors have their own electronic health record. It's pretty good. A lot of them have the same one. In the
Okay.
hospital systems, lots of people, as a private practice doctor, we all have our own. They're not the same as the primary care one. They're not plugged
Right.
into each other. The
Wow.
hospital has its own system. It's not complete as an AHR. That doesn't talk to any of the other systems. So if
Wow.
you go to a hospital, say in the west of Ireland, you have a couple of x-rays, you can, through some systems, get access to the x-rays. All the other tests you can't get access to because none of the systems talk to each other. So the government, in fairness to them, is in the process of building out a unique electronic health record for the country. Our
Right.
hospital and a number of other hospitals are going through new iterations. So it is a kind of priority project. But if you think of sticking AI in there on top of what we have as an existing issue, you're not solving any problem. And so we have a lot of companies approaching us saying, well, you know what, we can put stuff on top of what you have. We can kind of make a solution for you that ultimately is not really what you should be chasing. We should be solving the problem that's there in the first place. So, and I think that my comment about EHRs has always been the fact that it's very challenging to do research on patients when the data is housed in multiple different silos and you have to effectively get a fellow to go around and do it. Whereas all the benefits of what's there, particularly in terms of the AI benefits, to make the whole process so much more efficient, even to do that would be brilliant. But I think that the country is a little bit behind in terms of its infrastructure and the way it's been delivered. And a lot of that is not that the technology is not there, it just hasn't been implemented. So all those things were a good bit behind, a little bit like where I was in North Carolina 20 years ago.
You're right. Now you're like in a different
Mm.
seat in another another
Yeah,
place almost.
yeah,
Wow,
exactly.
that's interesting. It's interesting because New York almost had we've always had EHR systems, but it was kind of almost similar, like how you said, where there was a bunch of places that had just different EHRs that didn't speak to each other. Like if you were like in Long Island, they had one EHR system. But Long Island is so close to Queens, so now if you're in Queens, the borderline, and you're seeing a doctor in Queens, but you live in Long Island, a lot of those things just didn't overlap, or there was just a harder way to overlap. Now in recent times, everyone is collectively starting to get on the same EHR platform. Epic being the number one in New York. We have Athena as well, but Epic is the larger health system. Epic is usually the number one provider. And we've seen how easier things have become now that a lot of these health systems are adopting the same kind of processes. Even if you have like a smaller practice or individual clinics that might be associated with the health system, it just got a lot more easier. I guess in your work and your experience, are what are you seeing from the provider standpoint or specialists? Like, are there clinicians or providers who are heavily for AI and want to implement it, or is it like a bunch of people like, hey, I don't think this is a good idea. I think we're doing things well, and I don't want to even mess with this stuff right now.
So it's a great question. It's a very interesting one because because the country is relatively small, the opportunities are good. But if you take somebody say like Microsoft has all the tech companies have a huge presence in Ireland. You've got to bear in mind like the likes of Stripe, which is very well known as a paying network, is an Irish creation by two Irish guys in the west of Ireland. That's where it's come from. And as a country, we host the headquarters for nearly every tech company in the world who wants to do business in Europe. And there's lots of different reasons behind it. So if you take Microsoft and their different AI work and platforms, yes, they have some stuff in health, but is it being leveraged through the Irish health system? I don't know the full detail. And certainly you meet a lot of different people working in the AI space. You meet a lot of startups. And a lot of where I've been very fortunate to get involved in is a lot of the context I would have maybe patients of mine who happen to work for bigger companies who love to have an opportunity to talk to somebody who's in the health space and who will tell me, well, I run the AI service for Microsoft as an example, would love to sit down and explain to you what we do, would love to sit down and see what are things we can do with perhaps with your hospital. But you're at a very, very early stage in all of this. You've got to understand that we're only getting started. We're just trying to test certain things out. It's interesting, you meet a lot of people who work for big companies. Microsoft's a good one, but you meet other people working for big startups who are not necessarily working in healthcare. They're working in other industries. They're trying to solve problems like, as Kizar was saying, or you said it as well, like in sales, dealing with customers, dealing with complaints, dealing with even what do I need to do to come in for a procedure, where's the hospital, all these sorts of things that an AI tool can do or a chatbot can do, whatever it may be. But the point about this is they're not necessarily in healthcare, trying to integrate all of those things. They're just huge. We're just not at that sort of strategic level as yet. We're only starting off and we're only trying to learn as we go. So I think the bigger strategic direction that we pick is just not decided. And I said to you, trying to solve things like our own dedicated EHR in our own hospital is a huge project. That kind of AI plugged into it. I mean, a lot of the providers who do our diagnostics, like the GE, the Siemens, those companies who provide all our X-ray equipment, they all have a degree of AI. But the problem is they want to charge even more money than the service contracts to the hospital. And because the hospital doesn't understand the value of AI, we invariably have other third parties trying to offer us solutions that you can literally plug in on top of some of the tools we offer. So again, it's just not completely joined up. It's not completely clear. And so you're learning off people who happen to say, I do AI, and everybody's offering this at the minute. And it's just sort of wide open that the truth is, do you wait for it to settle because you think it is a better place to be? Do you get involved so you know what the conversation is like? Very like the internet when it came out, I might add. Or do you kind of just try and pick companies that you think will solve a health problem, but they themselves, half of them, don't even know the answer to that either. So it's all a bit of a rush, to be honest with you, but there are benefits in certain things. I don't think anybody's sort of joining us up strategically to work out ultimately what is the benefit, apart from picking off little projects that will help certain things.
Actually, but what we have observed is like we have talked to a lot of healthcare professionals. A lot of them believe in AI, that AI can help improve their workflows, optimize their operations. But when it comes to practically integrating the AI into their operations, they become skeptical. They look around in their environment that if another healthcare practice is integrating that particular AI in their operations, then they are good to go with that. But if they think that they are alone, who have to integrate the AI into their operations, they become skeptical. But when we have talked to you, and like it's amazing that how you guys are integrating AI into your hospital operations, in improving the patient experience. By the way, my question is, what is the general perspective of AI in the hospitals and the healthcare domain, particularly in the Ireland?
So I think you're talking about a small number of people who have a little bit of an interest. There's a lot of startups out there in Ireland trying to build AI solutions for different projects. But you're talking about, say, a handful of consultants or doctors who are kind of saying, well, I like this. There's a lot of it appearing in radiology, actually, it seems to be where most of it's coming from. So a lot of it's about sticking AI platforms on top of diagnostic x-rays and saying, well, I can predict breast cancer in a chest x-ray. I can predict lung disease in a chest x-ray. And a lot of the interesting thing around that, even when you get to get a hold of it, what you realize is there's a huge ethical piece to be worked out is what are you going to tell the patient? If a patient has a predicted risk of cancer in 30 years' time that the regular chest x-ray doesn't show, well, does that mean I have to have a chest x-ray every month, every 6 months, every year? How do we communicate that information? Who is responsible if the information is accurate or inaccurate? And what about 30 years of x-rays? I mean, is the radiation alone going to give me the cancer anyway? So there's a huge amount of those questions in the healthcare space. And I think that for a lot of doctors, when you have to hang around, because AI is offered as this kind of magical quick solution. Yes, it'll tell you this. But then when you have to hang around and work out that it's going to take an awful lot of other layers before you can actually deliver it into patients, you come back a little bit like you do to the research world, where a lot of people that you pick out, whether you're really bought into the research, you're really bought into the engineering, you're bought into the technology, you're bought into the coding, or you're a clinician who just wants to grab a fancy tool, plug it in somewhere, and then you'll work out what its value is. And I think that just steps back to the idea that it's a bit like the internet. Everybody's rushing in at the minute because it's the latest, greatest thing in town. But very few people are actually going in there and adopting it in a way that's very strategically minded, that it solves a problem and that it's going to help patient care, as opposed to let's just plug it in because everybody else is doing it.
1000%. I think that resonates because even with the professionals that we work with, we often say, even going into it, I think it is a thing called shiny object syndrome, right? Everyone is seeing like all the new things with AI and everybody's running to it. But we often tell our partners or a lot of our clinicians that we work with that when you're incorporating AI, because a lot of times we will come into a clinic where they already implemented some type of AI, but it just isn't working for them. And my first question is, who is the AI person? Do they have a healthcare background? Because it's different when you're talking to someone, AI person who is just a builder of AI. They're technical. They know how to do almost everything. It's different talking to a person like that versus talking to someone who has the healthcare background and then is building AI, because now they understand how to be compliant, HIPAA compliant, or they know how to make things more patient face or ideal for patient facing either providers or clients, because they themselves have sat with a patient before. Like myself, I've had client facing roles in my journey. I know that, Mrs. Jones might have high hypertension or diabetes, but she's also on the verge of eviction, so she's not going to her primary care because she needs to pay her bills. We understand a lot of what happens on the ground level and at the top level to kind of incorporate these technologies in a more intentional way. So we always say, just free advice for any of the listeners or anyone in Ireland that you might be talking to is, we always say go with someone who's an expertise in that niche to then implement AI. The good thing about Kazar and myself is we come from that health background. Me more so on the medical medicine side, him on the dentist side. But we're not doing AI for like restaurants or hospitality hospitality or hotels because that's just not our expertise. Of course, we could build something similar. 100%, I could build an AI receptionist for a hotel, maybe, but I don't know the nuances of what a hotel may go through on a day to day to equip the agent with all of the capabilities to be effective, if that makes sense. Yeah.
You're right,
And
Anthony, because one of the big challenges is, like the shiny object syndrome. One of the challenges is trying to be all things to everybody. If you try to
mhm,
be all things to everybody, even, that, as you say, if you're in hotel or if you're in tourism or if you're in technology, whatever field you're in, if you try to cover everybody's problem, you invariably don't get anywhere because you spread yourself too broadly. And I think in healthcare, you try and bring it down to small little niches. There's enough people in the world who live on the planet with the same
right.
health problems. You don't have to worry there's not going to be any work. There's plenty of it. But I think the reality is you've also got to pick up small steps to start off solving problems. I think if you run the risk of trying to cover too much just because AI can do that, you really lose sight of what you're trying to address in the first place.
1000%, and you're 100% right. Like there's so many ways to incorporate it. There's so many people. It's just getting the right people in the
Yeah,
right rooms, right? Like the
yeah,
ideal team would be. I'll say the ideal team for like a healthcare provider would be the entire care team plus like the AI guy, the IT guy, all in one room trying to build something together. That'll be ideal because then everyone's bouncing off questions versus at least what we're seeing in the US, there's a lot of AI tools or decisions being made at the top of the funnel that doesn't really do the value on the patient level, right? Like I think we were saying it earlier. It might solve like something on the back end or some type of automation that makes the work quicker, but what does that do for patient satisfaction and things of that nature? I think that's where, at least in the US or in New York, we're missing the ball when it comes to incorporating AI.
I think
Um,
I think you are right. I think we have the same problem. I think if you do not understand the patient journey, the danger is that if you put an improvement with AI somewhere up the funnel or somewhere in the organization that you think is going to solve the problem, you got to be prepared for what happens downstream, even though you weren't
mm,
intending to do that. One of the challenges where the data is limited or where the system is incomplete is you probably create something pretty awful.
mhm,
And without the system being complete, and trying to tap the system or put a plaster on the system with an AI tool doesn't solve the problem either. So you really just
mhm,
got to try and understand what the problem is, and you got to understand that the data points or the data sets that you're using, you're trying to help solve a problem that's either maybe unmet or you're trying to solve a problem that you already have. You've got to understand all the different data sets that have come in there, and I think one of the most fascinating stories to share with you is it's highlighted actually by a very well-known cardiologist in New York.
mhm,
He's a Spanish cardiologist. His name is Valentin Fuster. He's one of the absolute godfathers of cardiology. His fellow wrote an article in a cardiology journal many, many years ago stating that when you do clinical research, it's not unusual that you don't actually answer the question at hand. You often will wander off into another direction because something catches your interest. And you spend a long, long time going down that sort of rabbit hole and not coming back. And which is a very interesting letter to pose because his boss, Valentin Fuster, followed up. He was the journal editor, followed up and said, you know what? My fellow is absolutely 100% right. We are great at wandering off, trying to say, well, smoking causes heart disease. Let's wander off down some tunnel as mech and blah, 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 blah. Ultimately come back, we know that. And I think with AI, the danger is very similar. I think the danger with AI is you look for a problem in your institution or in the science that you work in, you say, I'm going to plug in AI, and guess what? AI wanders off to the side. And you see that with a lot of the search engines that are out there at the minute. It's pulling data that you might think makes you look absolutely wonderful, but in some cases it's making it up. I mean, there's great work about scientific publications at the minute that some people will say that the scientific publications will publish. And then when you go looking for the references, if you do that, because lots of people don't, but when you go looking for the reference citations, they're not there. They've all been made up. There's a number of also well-known cardiologists in America who've had academic papers published in their names in certain parts of the world that they have never actually written in the first place at all. So there's lots of different things going on in the health world through the use of some of the new AI technologies. So there's just I suppose the internet you had control of. The internet was not being forced on you in terms of medical sort of innovation or process improvement or whatever. AI has come in here sort of tsunami level. And AI has come in here promising everything. And anybody with AI in their hands think they've solved big problems. And I think, I think what will come to pass in a shorter period of time is people have created more problems than they've solved. And as you said, part of that is because of the fact that they get bored, that it doesn't deliver what they want it to deliver, and they move on to something else. So I think that, as I said, I think it's early days. I think all the listeners out there can make their millions on AI tools in healthcare, but you just got to get it right in the first place to try and work out, because what the real challenge in healthcare is, we've made the system really complicated. Putting an AI kind of avatar on top of me to solve the complexity is not what the AI is able to do. The AI is able to answer the question in the beginning, as to say, well, let's understand the process. Where's the complexity? Let's say that you can't access a doctor. Okay, so why is that way? Are there systems that you could use that would help to get information like that? We have things like that, which is called telemedicine. But the problem is that people don't necessarily use all those things. There's lots of little problems, like some people don't want to pay for the phone to ring the doctor. Some providers don't want to give you the tablets from ringing the doctor that way. So there's loads of different connections that you can't assume that they're perfect. Put an AI tool on top of it and say, hey, presto, I've solved the problem. You've got to be much more clever than that. And that just lands to your comment that you need all the stakeholders who are actually involved, including the patient, including the doctor, including the payer, including the hospital, including the IT people who actually know what the technology does, and including a lot of people, which might seem like this is a huge expense. But if you want to make it work and you want to make it deliver value, it's important to get it right.
So it resonates with that resonates, because it's like you don't want to versus in that scenario is very intentional and specific. And if you have the clinician, the patient, the builder of the AI all in one room brainstorming, then it's super intentional versus you don't want to be in a scenario where there's a jack of all trades and a master of none, right?
Yeah.
If me and you are in the room, Dr. Robert, I'm pretty sure you're going to be able to see things within this AI tool that I'm building that I won't even be able to see. And then hindsight is going to make it better. And I think that's where the trajectory of AI or technology being incorporated into healthcare, that's kind of where we need to be and go in order to really see this thing through without as much mistakes as possible. There's gonna be mistakes, but if we can limit it, it will be to put everybody in the same room and then have a conversation.
But just for your listeners who may be medical, it's not to say you can't do things that'll improve your day-to-day work. So,
right.
The AI scribes, as example, are brilliant. Now, most American hospitals have those now, where you can actually, you talk and it can dictate everything for you. You can edit it. It can generate doctors' letters. I remember when I worked in the US, we spent at least 2 hours every day writing notes in the patient's chart in the morning and in the evening, following it out the way that HIPAA said we should write it, that the insurer said we write it. Then the attending had to come along and do the same thing. I was an attending as well. I had to do the same thing, purely for billing reasons, not for any other reason. So a lot of those technologies do save you time in terms of doing those different tasks. There's a lot of other ones, as I said in the example I gave, in terms of where we're looking at this in some of the cardiology test processing. And there's certain elements that will sit on top of radiology. There's some wonderful cardiology work out there about using mammograms in women by plugging in a technology that spots calcification in breast scans that might be an early sign for heart disease. And that, as an example, is quite amazing, because women are a group of the population where invariably we miss the diagnosis of heart disease, or women don't get detected earlier on. So even showing up for your mammogram could be an amazing life-saving opportunity for your heart health. Not just for the check for a breast lump or for breast cancer risk. So there's a lot of wonderful AI tools out there to help individual sort of efforts, but trying to do it at a scale, at a bigger level, at a hospital level, at a public health level, is a slightly different proposition.
Day to day is the way to start, I usually say, and then we could maybe take it higher. Because even when we're talking, whether it's like for where we're setting up an agent or anything like that, a lot of the time a lot of people are getting getting an introduction in AI at work versus a lot of people aren't even using it in their day to day, so they really don't understand it. So oftentimes we usually come in and say, "Hey, use this tool for a week," and then come back and then we build something, or get familiar with how AI works. That's usually the approach we take, and then we see that has been fruitful. But this has been like a super amazing conversation and super valuable. I appreciate it. My one last question, well, two questions I have for you. One is, where's the best way for people to kind of connect with you? Whether, you might have said something and a listener want to reach out and maybe ask a question, or any resources they could connect with you online. Where's the best channel that someone could actually reach out to you? And then also, what's one powerful message you want to leave with the listeners? It could be about anything we spoke about today, or just something personal to you, whatever that means. So what's the best channels to actually connect with you, Dr. Robert? And then also one powerful message.
So the best channels to connect with me is that I am across all the social media networks. The one I spend the most amount of time is on LinkedIn. So you'll find me under Dr. Robert Kelly. I have a website, www.drrobertkelly.com. The Kelly is Kelly. A lot of Americans spell it with an extra E. I don't. And then the other aspect of this is, I work in a hospital in Ireland. It's called the Beacon Hospital. If you look that up, you'll find me that way. But if you want to reach out to me, you want to talk to me about what I do, or you're interested in learning more about me, you can find it through my website. There's a lot we didn't talk about today that I do. One of the things about cardiology for me is that I really enjoy looking after patients. I really enjoy the conversations. I said at the beginning, I wanted something acute in medicine. In hindsight, I'm absolutely delighted it didn't turn out that way, because I really get everything I've ever done, be it identifying their problems to help solve them with AI, whether it's about coaching programs, books, other things I've done. The patients have been my source of insight, my source of inspiration, and an awful lot of my source of content. So, anything to do with dealing with people for me in terms of the cardiology world is what inspires me. So that's the parting message, I would say. If that resonates with any of you, you want to explore with some of the stuff I've done, you'll see it through my website. Please do reach out. I really enjoy talking about these things.
Definitely. And thank you so much for your time, Dr. Robert. We appreciate it. And I know that this conversation will bring a lot of value to the listeners.
Good. Thank you very much.